My name is Skylar Christensen. I'm going to be doing the skill of IV medications and piggyback. First thing I want to do is verify the physician's orders. This physician has ordered fluid and medication. The medication is going to be amoxicillin. I have done the math for our required medication and fluids. So it's been ordered 150 milliliters over 60 minutes at a drop rate of 15, which gives us 38 drops per minute for the fluid. Our medication, which is amoxicillin, he wants it 15 drops per minute over the hour, which gives us 100 drops per minute. That's going to be in the form of a 100 milliliter bag. Okay, so I'm going to first do hand hygiene and put on my gloves. So whenever we're doing any medication administration, we want to make sure that we've verified the 6 rights of medication. It's going to be right patient, right drug, right route, right dose, right time, and right documentation. So we would want to be sure to do that with both of those. Before we get started with all of the piggybacks and stuff, I'm going to walk you through my tubing and what all of the parts are. So this is going to be our 15 drop initial set. This does have some fluid in it. I have been practicing with it, but you would want to make sure that they're sterile and fresh. So this is going to be the spike chamber. This one, you want this to remain sterile until you spike it into your initial bag. In here is going to be our drip chamber. This is where you're going to see the drips coming in. This is also what you're going to squeeze half full to prime the tubing. We also have our roller clamp right here. Open is going to obviously be higher flow, and then closed is going to prevent any. When spiking the bag, you want to make sure that this is fully closed to prevent any unnecessary leaking from the of the fluid or the medication. This is going to be your Y site. This is where you would do any push medications or any additional fluid requested by the doctor. For today, we're going to be using this as our adapter for the amoxicillin, our piggyback medication. And then this is going to be what would, if we had an IV on the patient here, this would be what you would attach to your patient and their IV site. For sake of not having a patient here, I'm just going to be setting it on the towel or dripping it down here into a trash can that I have. So this is my initial one. I'm going to set it right here on top of that bag. My secondary set, same thing. We're going to have that spike here. This is the sterile spike that's going to go into the amoxicillin or whatever piggyback medication, whatever you have. This is going to be the drip chamber. This is the roller clamp. This does not have a Y site. This is going to be the site that you're going to uncap and attach to the Y site for the amoxicillin or whatever piggyback is to be administered. Alright, I'm going to go ahead and get started. So we have our fluid. Of course, I'm going to check medication. I'm going to make sure the curtain's closed for privacy. I'm going to verify the patient with 2 patient identifiers and then go through the 6 rights of medication, verifying the MAR, right medication, right route, right dose, right patient, right time, right documentation. After I've done that with that, I'm going to go ahead and uncap the amoxicillin or the fluid. I'm going to ensure that my clamp is closed. I'm going to uncap the spike, and I'm going to go ahead and spike all the way down. And then again, make sure it's closed before I flip it over. I do have 2 hooks set up over here. When we're doing piggybacks, we want to make sure that the fluid is lower than the piggyback that's going to be going in. So I do have this one set up lower. I'm then going to prime the tubing. So I'm going to squeeze the chamber half full. And then I'm going to go ahead and run fluid through the tubing so that there's no air bubbles. once there's no air bubbles, I'm going to go ahead and then calculate my drip rate. So I'm going to adjust here and count for a full minute once I have it going. Alrighty, so now that I have it calculated, I watch for a full minute. This is going at the prescribed 38 drops per minute. I would leave this going if it was connected to IV. Since I might have to practice again, I'm gonna go ahead and just clamp this off. A couple things I just want to mention. This would have a little protective piece on it. I don't know where it went when I was practicing, so obviously this would be sterile before connecting to the patient. And then the other thing I did mention is you want to make sure that the bag is 30 inches above the patient's IV site. This is all I have to work with right now, but I would ensure that in a hospital setting. So once that is done, you're going to go ahead and move on to the piggyback. So let's set this down. Same thing. You want to make sure that your tubing is completely closed. So tubing is completely closed. I'm going to go ahead and remove the cap off here. Remove the cap off of the amoxicillin. And again, just to confirm that I said it, you want to make sure you're verifying the 6 rights of medication before doing this, checking allergies, especially with amoxicillin being a high allergy. All of that I've already done with my patient. I just want to confirm that with you. Alrighty, so then we're going to go ahead and do the same thing. Make sure this is hung higher than the initial one, since this is going to be the piggyback. We're going to go ahead and prime the tubing again. So this is closed right now. Squeeze this about half full. And then we're going to go ahead and prime the tubing. Once that is primed, then we can go ahead and attach to our site. We're going to go ahead and use an alcohol swab. We're going to clean off of the site. You want to make sure this dries before you connect. You're going to go ahead and take off the cap, and then we're going to twist this on. And then same thing, this is prescribed at 100 drops per minute. So for the full minute, I'm going to go ahead and count. So I get the right drop rate for 100 drops per minute. This will probably have to unroll a little bit higher since the drop rate is going to be much faster. Now that I've verified for the full minute that this is at 100 drops per minute, I would keep this going if this was in real life, but since I might have to practice, I'm gonna go ahead and clamp off. These would keep going. This would be connected to your patient. After that, because I did just connect an IV, you wanna check for any infiltration, redness, irritation. It is an antibiotic that has a highly reactive, high allergy rate, I should say. So you want to check for any signs of anaphylactic reactions and make sure your patient's comfortable and everything feels okay. After that, I would make sure the call light's within reach. I would collect all of my trash. I would remove my gloves, throw them in the trash, perform hand hygiene, and then I would go document my results.